ever since I was a little girl, I always knew I wanted to be a drug dealer. The legal kind, though. Someone who creates medicine and dispenses it out to people so they could feel better. Pharmaceutical field is a very vast and very important occupation to be in, because without it, everyone would just stay sick and no one would be able to feel better. There are many different settings in which you can be a pharmacist. The first setting I want to talk about today is at a research lab, and these are the people who research new medicines that could help people and create the new medicine. That's a very important position to be in, because it could possibly be very dangerous. If you mess up, it could hurt someone very badly. The next setting I want to talk about is at a hospital. These people consult with doctors on certain prescriptions to give patients and the amount of dosage and just everything that could help the patient feel better. They follow the progress to help doctors decide, whether to lessen the medication or keep going. The last setting I want to talk about today is at a retail store. These people count the medication and dispense it to patients after a doctor tells them what to give them. They also discuss the side effects and the amount of dosage that each consumer will get. There are certain pros and cons to being a pharmacist. According to the Bureau of Labor Statistics, pharmacists make about $55 per hour and $115 per year. This picture shows pharmacist salary. Being a pharmacist for 1 year or less, you'd make about $82,000 per year. But then when you get up to 20 or more years, you make about $103,000 or higher per year. And this picture shows that women in the pharmaceutical occupation tend to make more than women that are lawyers or physicians. So that's pretty interesting. A con to, or a downside to working as a pharmacist, they work at least 40 hours per week, and they occasionally work nights and weekends. So that's not the best. There's lots of studying involved in being a pharmacist. First, you have to graduate high school, and then earn a bachelor's degree. Then you take a test to be admitted into a pharmacy college, where you would study pharmacy until you earn your doctorate of pharmacy. And then you become a licensed pharmacist, and then you find a job. This is a very dangerous field, like I said, and it could potentially hurt someone if you were to mess up. So there's lots of studying involved. So.
You have to go around it.
Huh?
Don't you have to go around it again?
It's fine. I think it's it'll be okay.
Oh, are you sure?